Dr. Newirth was a professor at the Derner Institute for Advanced Psychological Studies at Adelphi University, as well as our former director at the postdoctoral program in psychoanalysis and psychotherapy at Adelphi. He's taught and supervised psychoanalytic candidates at the NYU postdoctoral program in psychotherapy and psychoanalysis and at the National Institute for the Psychotherapies. His book, Between Emotion and Cognition, The Generative Unconscious, published by The Other Press, received the Gradiva Prize for Critical Analysis and Interpretation in 2004. His second book, From Sign to Symbol, Transformational Process in Psychoanalysis and Psychotherapy and Psychology, was published by Lexington Books and received the American Board and Academy of Psychoanalysis Annual Book Award. He's currently working on a new book, The Unconscious, Contemporary Perspectives, for Routledge Press, and his practice is here in New York City.
First, before I get going, I want to thank you and the Society and the program and Amira and John for inviting me to be here and to do this. I really think it's a very interesting set of ideas that we'll be discussing, and I hope it's going to be informative and exciting. Since we, one of the things we'll be talking a lot about, I believe, is self-disclosure as kind of a clinical element. So I want to say a few things about myself, which will probably become more elaborated as we go along. I don't consider myself to be a big R relational analyst, although I grew up professionally in that world, and I count many of the theorists and authors as my friends. However, aspects of my personality led me into a different direction. I've always thought of myself as split, an engineer who loves to understand how things work, and a poet who wants to generate new experiences with words. In the context of this workshop, I would consider myself a small R relational analyst. My interest in the unconscious language and culture have led me into, and this is kind of a different perspective than John's, into a postmodern structuralist and third generation Kleinian camps. John, I want to thank you for opening up your book and mine to us. I know that you value debate, and I have spent a great deal of time studying your book and have many thoughts, which I have tried to organize using several categories, which go from the more abstract and academic to the more clinical. I hope that these categories will help us to focus on the complexity of your work and criticism of the relational position in psychoanalysis. The kind of first kind of category that I would like us to I'd like you to comment on. So John, I'm gonna ask, some of these things are formed as questions and some of them are formed as statements that, I'd just like you to respond to, or we can discuss together. So, kind of in looking at the philosophical roots of psychoanalysis and relational psychoanalysis, you seem to prefer the modernist perspective and want to limit the use of the postmodern and linguistic term. So part of that view on your part, which I think you were referring to just now as embodiment, is kind of seeing biology and drives as the kind of foundation of psychoanalysis, as opposed to culture and language. And I think these are really two separate positions, and I think they're equally valid, but I'd like you to comment on that.
Yes, well, first of all, that's not my position. That it's easy, keep in mind that when I was critiquing people, it doesn't necessarily mean that I'm wanting to advocate for a certain position over the other. because in reality, psychoanalysis is a very robust and sophisticated theory of mind and culture. And for what I think is important here is that we should have more of a holistic perspective that we would want to take around both, philosophy of mind and culture, rather than pit one against the other. Even though I am critical of a lot of pomocentrism that I call.
What's that word?
Postmodern centrism.
God, I have it.
Yeah. Like the fact that we're so complicated as a species, that the human sciences is such that we need to take into consideration all these perspectives and be open to when does one present more of a clearer window into truth and reality versus another. And so, of course, context, contingency is always wed to any situation. But in another book I wrote called Origins on the Genesis of Psychic Reality, I start with the notion that we have an unconscious ontology that prefigures both conscious development and the acquisition of language and being thrown into our cultural environs. And this largely draws from the traditions of Freud, of Hegel, and Heidegger. So you can't deny our embodiment, our what we want to call drives. We have, this is what we find ourselves in, just like we find ourselves thrown into a world, and that world is also structured in various different ways, socially, linguistically. But before we get to that world, before we breach into consciousness, we have to see how these things are prepared. So for instance, even in linguistics, that the notion that you have these unconscious structures that allow language to occur a priori, they must be there, is no different than the notion of our urges, our desire, our complexes that will later come about. So what I'm wanting to advocate for is what I call a developmental monistic ontology. I'm starting with the most basic, and then we then branch out dialectically into the greater whole. And but do I want to say one is better than the other? Well, I offer various arguments for that, but it's not to eclipse the fact that postmodern thought doesn't have value.
Right. I want to push a little bit on that. Okay. And maybe I agree with what you're saying. I agree with a lot of what you're saying. I think the part that I'm not quite agreeing with is that it seems that you're kind of putting what I would call kind of a one-person perspective rather than a two-person perspective into a primary position. And I would do the opposite, which is not to deny the biology of it. And the more we learn about the biology of it, the more interesting it becomes. And we're living in a time that neuroscience is giving us a lot of information about how the brain structures the mind, or the mind structures the brain, or whatever. But that in some ways, I think there is, I don't know whether to say a preference on your part for kind of a modernism, even, kind of words like truth make a few hairs on the back of my neck stand up.
Well, okay, let me try to clarify. First of all, I would dismiss outrightly the notion that there is a one-person psychology, and that Freud never says that. He never says that in his words at all. It's not in his texts.
No, I don't think it is at all.
Yeah. So, but am I privileging a one person, the intrapsychic over the intersubjective or the relational? It just depends upon what I'm focusing on in the moment. Like, the minute the baby's born, I mean, there is no, insular, solid world, right? I mean, you're thrown out into a multiplicity of objects, and that you form an attachment with, let's say in your family, and which unfolds in the broader communal structures of society and culture and language. And so we can't divorce that. I mean, that's there. It's just the way it's integrated, assimilated, identified with, and internalized into psychic structure over time, that we then can see how we can differentiate things out a bit. But they're never divorced from one another. They're always interdependent. So yeah, some of the terms like two-person versus one person, meaning the object over the subject. These are some of the false binaries that I think people have introduced, unnecessarily so. To say, do I prefer modernism? So we're talking about the rise of modern philosophy, early modern philosophy, through to the Enlightenment of modern science at the time. Do I value that? Well, yeah, I think that I believe that the world exists independent of my mind. And whether I like it or not, certain things are there. And let's say that's what the physicists study. I would say I believe in realism. And so when you say there's no objectivity, if you have an issue around objectivity, we need to discuss what you mean by that. Just like truth, what do we mean by truth? Because these have different significations and meanings to people in different disciplines throughout the history of ideas. So yes, I do believe that, but I also believe in the notion of perspectivalism, the phenomenology of the lived experience, and that these things can more often than not preoccupy what defines personal identity. So it just depends on what angle we're taking. I do not believe that everything boils down to language, and I do not believe that everything boils down to the brain, because there are many things that take place outside of both linguistic structures that are valuable. Like there's pre-verbal experience, for instance, before a child acquires language. There is affective experiences or somatic experiences, symbol formation. There's aesthetic experiences. There are what you might call extralinguistic, mystical, spiritual, things that wouldn't necessarily be boiled down to, the signification of certain words. But what I do like about postmodernism, particularly if you're reading Derrida or at times Foucault, or Lacan, that the notion, and this actually comes from Quine. Quine's a godfather, so to speak, of postmodernism. He's introducing the notion that semantic structures aren't stable, that there are that meaning it's not fixed. It doesn't belong to a word. A word doesn't signify just one meaning. And so you have two different approaches in continental philosophy on one side and in analytic Anglo-American philosophy on the other, that are more or less saying that there's an infinite deferral of significations that can descend down a chain where we lose the original meaning structure, just like we lose the origin of words and what they originally meant and signified. So this is the plasticity of language that's very important.
Yeah,
to-
I agree with you completely about that. I have strong feelings about that and about the forms of language, which we could talk about. Let me, because I am watching the time move along. Let me, like, one of the areas that I think we would agree on strongly is that what's missing in a lot of relational literature is kind of greater depth, both greater depth in terms of explanations of what the unconscious is. I think you and I agree that the unconscious is the kind of central concept here. And I think there's a kind of a lack of that. I think that there's a lack of that also, which I feel, I guess, would be one of my critiques of relational theory, is that there's very little, like, you're a philosopher, you're connecting up things kind of historically in terms of philosophical, kind of movements and ideas. I'm much more of a psychoanalyst, so I'm a little lost in philosophy. But I know psychoanalytic ideas. And I think that's what's been missing in a lot of the relational literature, which is highly clinically focused. I want to get to that. Is a kind of the history of where these ideas come from. That a lot of these ideas come from, earlier analysts, Fairburn, Sullivan, particularly, Fromm, and, all of whom kind of moved away from Freud's idea of the unconscious, not the centrality of the unconscious, and that they saw people being ruled by kind of the repetitions of the past, so that it kind of leads me, I could talk about, like one of the things I'd like you to kind of talk more about is your vision of the unconscious, like what it is, what are its dimensions, how it works, and particularly how we address it in psychoanalysis. So that's one thing I'd like us to talk about. Another is the more particular kind of relational approaches to therapy, which involve a lot of self-disclosure, mutuality, symmetry, equality, and kind of directly addressing the power or knowledge of the analyst. So I don't know which one we should pick up first, John. I'm giving you a choice.
Okay, well, let's get to both. Maybe we'll save the second one for last because that's probably going to be more contentious.
Okay.
So I've done a lot of work on the philosophy of the unconscious. I've written a few books. My first one's called The Unconscious Abyss, then Origins, and then Underworlds. So I examine the philosophy of the unconscious in the three major psychoanalytic traditions. That's Freud, Jung, and Lacan. I've read almost all of their works, and I think those are the three leading psychoanalytic contributions to a robust theory of the unconscious. But I also look at the unconscious in Hegel and in German idealism, and also in Heidegger, in Sartre, and in Whitehead. So my own view, though, is most articulated in my book Origins, where I'm trying to apply Hegel's logic of the dialectic to how the mind or psyche initially comes into being. And so I take a certain dialectical approach to trying to, through speculative metaphysics, try to understand how the psyche, that little infant's mind, starts to develop. And how does it blossom? How does it breach into consciousness? And so I think that I'm not using a biological model, but the mere fact is that we have to emerge from, we have to be awakened from our immediate embodied existence, which we find ourselves as mind. But how do we find ourselves? I mean, there's various layers. I call it unconscious apperception, that we are at first in relation to our embodied existence, and that is through desire. We're desirous. We feel that we want, that we lack, that we wish to appropriate and relate and experience the world. But we also awaken through our sentience and through our affective reverberations. That's all takes place before you get to the perception of consciousness and concept formation, meaning.
May I interrupt a second?
Sure.
So the way I'm understanding what you're saying is that you have this kind of large amount of kind of body and kind of all kinds of experiences as an infant that kind of are starting to come together, but are kind of there. So but that's not quite the dynamic unconscious. That's like the kind of layer of the beginning.
Well, I would say that it is dynamic. It's powerful. It's procreative, and in many ways, in your first book, I agree with what you're saying. In fact, I reference you in my book. I reference your first book, and I take up your notion about the unconscious being generative. So I think we have a lot of similarities here.
Yeah.
But the other thing, though, is that the minute, of course, the child is born into the attachment system, the maternal environment, the family, I mean, you have a very rich and robust cacophony of experiences that are now being internalized, and the unconscious is now being filled with objects of experience, with memories, with desires that are being stimulated, defenses that are being stimulated, and the need to attach to love objects. So the minute you are thrown into the attachment system, now mind becomes a lot more complex, and also the notion between inner and outer becomes much more complex, because we're thrown into worldhood. We have our beings in relation to the world that we find, and that's our relation to ourself, to others, to our environment. I mean, very complex over-determination that's happening. Stop there.
Okay. But like, maybe I'm going to try to ask the same question in a slightly different way. Well, I actually wanted to ask a different question first. Like, what are your favorite papers of Freud's?
Well, I would say that his seminal mature works is what I most enjoy. So, Beyond the Pleasure Principle, The Ego and the Id, and The Outline of Psychoanalysis was, I think, his presentation of his most mature thinking. But Anxiety and the Inhibitions, group, the mass psychology and analysis of the ego. But you can't negate the importance of drives and their fate, or instincts and their vicissitudes. Very important paper. That's what anticipates the whole object relations movement. Freud introduced that. He introduced ego psychology, and the object relations school then reemphasizes the object. And then the interpersonal tradition comes along, and then self-psychology, and then relational.
I think this was a kind of more particular question. I think Freud's notion of the object, which is tied up to drives, it's the object of a drive, is different from object relations perspectives on what the object means. You know.
Well, by the time Freud, he didn't always feel the need to think the same thing all the time. So by the time of his later writings, he's really giving, people, that's what objects really are, not just part objects, but he's giving people the central role of an infant's life. He even says that the mother is the first and most important love object for all sexes, in his paper on femininity. So he's showing shifts toward.
Oh yeah.
Yeah,
definitely. That's what we all love about Freud. You see his mind changing and growing. That's great. Do you want me to answer the question that I just asked you?
You tell me.
Okay, so among my favorite papers are Beyond the Pleasure Principle. I think that's an absolutely important and brilliant paper. But then I go to the interpretation of dreams and Freud's kind of book and papers on humor. And then lastly, constructions and analysis.
Okay.
And so those have, that's just so we're kind of a little bit different, but that in the preferences, I don't know what it means to the audience, but I'm just thinking about what are these guys talking about here?
Well, it's interesting that we both said Beyond the Pleasure Principle first.
Yes.
And for me, the centrality of destruction or the death drive is something that I see. I see it has incredible utility. I'm a believer in the death drive. Other people will just want to dismiss it based upon biological grounds, but I'm looking at it in terms of an ontological principle that seems to be driving the psyche, let alone, look at our world today. I mean, we're imploding. I mean, if the climate crisis, the threat of nuclear holocaust, the social implosions going on in the United States in particular, but it's all over the world. I mean, who's not to say that there is some kind of larger collective destructive principle that's not operating? So I think that there's some value in how we look at that. And most people come into our offices are not there to chit chat about the weather or talk about how happy they are. They're engaged in all kinds of destructive manifestations in their life. And so I imagine we both would agree to some degree that this is important.
Yes, I think so. And I also think the idea of the repetition compulsion, like a central idea. And I think that kind of, although I don't have in my mind any kind of description in the relational literature about the importance of the repetition compulsion, I think it's a central part of it, because that's really the question. Why do we do things that bring us unhappiness, to quote Freud? And so let me just ask you to kind of clarify something, then we can move into kind of more clinical things like what I just said. But it's like you kind of in various spots in the book talk about being a subject, and I feel like I'm not sure whether you use the idea of subject and subjectivity in a kind of what I understand as a more philosophical sense of talking about the person, or in a more psychoanalytic sense, in talking about the capacity for kind of self-observation, capacity for self-knowledge, which I see as something that kind of evolves either developmentally or therapeutically. So I see subjectivity as a rare thing, not necessarily as a universal thing. And in reading your book, I was unclear how you were using the word subjectivity and intersubjectivity.
Yes, that's fair to say, Joe, that I'm using the term that historically would come from the philosophical literature. And, you know, we got to keep in mind that the concept of consciousness is a modern term. It's a modern invention. It wasn't part of the ancient world. So the notion of subjectivity really started to become part of, modern thinking, but really, German idealism is where we really see the philosophies of the will that are emerging, and how subjectivity are looking at the structures that allow consciousness and cognition to even transpire. But then shifting into your terminology, looking at subjectivity as more levels of self-consciousness or self-awareness is, I think, was what you are trying to emphasize there, which I would agree with. But I think we're using different terms. One is looking at universal structures that we would all, yeah, okay.
Yeah. So one of the kind of things that I'd like you to kind of comment on more is, so that part of the relational, way of working is to kind of move, to kind of really question the authority of the analyst. And just as a kind of, and I think that's part of a whole ethical system that's part of relational analysis, which comes out of a particular historical period. I think relational psychoanalysis grew up out of the anti-Vietnam War and anti-authority movements of the 70s, which we're still seeing reverberations of in our time. And so I think that the issues around self-disclosure, kind of symmetry, asymmetry, are really kind of embedded in a whole power system, where the kind of analyst decides that they will not have the authority. They will not be in that position of authority. That has advantage. I think it has advantages, probably some disadvantages. But tell me what you think about that and self-disclosure.
Well, I mean, this is one of the things that I've been quite praiseworthy of the relational literature. This is one of the reasons why I identify as a relational analyst or therapist, because that's kind of how I saw myself practicing, meaning that challenging the classical frame, or at least the caricature of the classical frame. And there's more of a authenticity, a humane acknowledgement of not knowing, of being epistemologically open, to not imposing a dogma on a client, and having gone through my my own analysis with a Bionian. So I mean, it's like this was fresh air for me to throw off some chains, so to speak, be more myself rather than have to pretend to be what others and supervisors expect of me. So that would be more like a false self, if you have to do what others think that you need to be doing, rather than that you're your own person. Now, Having said that, I do think that there are times that the analyst does know things, and that our patients have a need for them to know. And so
But when you say know things, do you mean that you have ideas in your head, or you believe your ideas are true or accurate or something like that?
Well, yes, it all depends upon what we mean by true and accurate. And is it about me or is it about them? This is where the context means everything, right? Yeah. Maybe it, you know, I'm certainly not, I don't present myself as a stiff person. Yeah, I'm a friendly, outgoing, in that sense, open individual. That's how I engage with people. And but that means that I'm not going to presume to know about your life, and I expect that you're going to be the one that's the expert on who you are, and you're going to tell me, and we're going to have a conversation or a dialogue that will lead us into unknown places, and we'll go there together. But for me to impose like these interpretation, you know, like machine, like a Pez dispenser on people, that's not the way I work.
Okay, you don't think that, right? Okay, so you're critical in the book of Owen Rennick and Lou Ehre, different spot, essentially around their kind of, I think with Rennick is his statements of everything is subjective, or however he says that. And with Ehre, it has to do with his asking patients to tell him what they think he's thinking, or some, you know, kind of what's going on in his mind.
Yeah, that's I wouldn't operate that way. I wouldn't invite clients to want to try to tell me what's going on in my mind, or pointing out the internal conflicts that I might be having. That mutuality is not really what they are there for. It doesn't mean that we don't have a mutual relationship that will develop organically, you know?
Right. So you're differentiating the quality of the relationship being more kind of warm and humane, or human friendly, 21st century now, and as opposed to okay, but I think they're trying to focus on something, you know, which is kind of what is more traditionally thought of as countertransference.
Yeah.
Right. So that, you know, both, and talking about like an awareness of what's in somebody else's mind, since we, you know, what's going on in our minds becomes a central issue for relational analysts to kind of reflect on why did I say that? What am I thinking now? Rennick, do you know Rennick at all?
A little bit. I remember, you know, I've got one of his books, but his classic paper on the irreducibility.
Yeah.
Yeah.
I mean, he's a very kind of bold, somewhat aggressive guy. So you can see that in his writing style. I see that in his writing style. You know, I know when I have taught his papers, I've tried to help students now, you know, kind of imagine him. But it's kind of about the centrality of the analyst subjectivity, you know, and I think you state clearly like some questions about that.
Well, on one hand, you know, we can't deny or divorce ourselves from our subjectivity. I mean, it's the basis of who we are. Our
right. No, right.
Yeah. But that doesn't mean it's all about subjectivity. I mean, why can't there? you have subjectivity, objectivity, and intersubjectivity. They're all operative at the same time on different parallel levels.
Right. No, I definitely agree that they're all operating at, in some kind of way. But I'm saying that the relational school values the kind of the analyst subjectivity in a way that's kind of very unique. And that's something that I think you feel critical of, which is fine with me.
Well, can you be a little bit more specific about what exactly I'm criticizing? Because on one hand, I'm
Sure.
I'm agreeing with what you're saying so far.
Okay, so like with the kind of little part where you criticize Rennick, where he says everything is subjective. Well, but what he means is everything that the analyst is thinking and is doing is a subjective experience. Is that, so that again, traditionally would be seen as a broad sense of countertransference, or from a Kleinian perspective, it would be seen as a lot of projective identification, and how we work with that.
So it depends upon the context of how we define subjectivity here. So I'm critiquing it, thinking that probably what it traditionally means to me versus it being about countertransference or projective identification.
Right.
So in that sense, then my criticism would fall flat because it's not, I wasn't aware that he's talking about subjectivity as countertransference enactments or as, So if that's the case, and he's using the term subjectivity in that way, then I would have referred to it differently as our own unique, personal dynamics versus using a term that could be broadly applied to all human beings.
Right. It's kind of a more specific version. I think that's what I think when we think about kind of self-disclosure and the analytic relationship, we're really disclosing our what would have been considered countertransference.
Yeah. So
right?
in that context, I've had plenty of problems with my own countertransference with patients. I've written about it. And so I can identify, when either I've done things that haven't been helpful, or I've done things thinking that they would be helpful for me to be more personal, self-disclose about myself. And of course I operate that way. It's not like I'm not going to answer questions that patients would have of me if it seems to be appropriate context, but it's the realm of excess that I was more concerned in, and the therapeutic.
You mean a little is good, then more is better?
Well, not necessarily. Yeah.
I mean, at some point we have to stop.
Yeah, I'm sorry. That's true. It just time goes like that, right? The thing,
Okay.
I'm
sorry. Go ahead.
This is where every clinician, presumably has their own internal self-discipline and intelligence to make judgments about what they think are appropriate and suitable in that context with each therapy session. So is there dangers with excessive forms of self-disclosure, let alone self-revelations? That's where I'm more conservative. Yeah.
Right. No, and I think that's great, because I feel like what's not being said here is that this is a dimension, that one of the reasons I brought up Rennick is because I think he's on an extreme end of it. I think Aaron is a kind of a more conservative person. Maybe somebody's even more conservative than that. And I think what's exciting to me about that idea is that we have to kind of figure out where we fall on that. Something that I think is that we rarely talk about is how the analyst personality fits in with these things. Like, you know, are you more conservative or more risk taking, whatever? But I think that's a dimension in terms of disclosure. So let me ask you to kind of focus. I want to focus on two other things, and then we'll have to stop. One is like Jody Daly's paper. I kind of enjoy. I like her work, but I enjoyed your criticism of it, particularly when you said something like she seems fascinated by sexuality and obsessions, since she's published a bunch of papers on that. So, but that was kind of a more extreme self-disclosure.
Yeah.
Right.
First of all, I absolutely applaud Jody for having the bravery to put her work out there. I really admire it. And if people aren't honest and tell us how they really work, we don't know what's going on. And we don't know who to believe, because I think a lot of people who write a lot of clinical material, they want to present their best stuff. And, you know, they don't want to talk about the screw ups and what went wrong and how things dissolved or the relationship failed or somebody bolted from treatment. So, but
Right.
In that particular, the classic paper, Love in the Afternoon, I mean, to me, it was ripe for the picking. And yeah, when you say to somebody you want to screw them, more or less, how do you rebound from your lust? How do you repair the relationship? My guess is it was a graduate student or a person in training, and that person bolted, because I couldn't.
Is that a fact, or is that what you think?
No, that's what I don't know if it's a fact, but if it would stay in that situation, maybe they worked through it, but it was extreme.
Well, I think it's very extreme, and I think in that series of papers, I think Jody was trying to do a couple of important things. One is, again, kind of talking about self-disclosure and or countertransference, whichever way you want to do that. But the other part of it is, and I think this is an assumption that relational people will make, is that that the kind of the patient, the other person, already knows these things. It's like I kind of use it, the way I describe it is like family secrets, that we're all trained not to say certain things in the family, and usually those are the things that are making us crazy. You know, so those are kind of like family secrets. And so I think that part of her courage was kind of being able to say something that she thought was already going on with the patient. I think the other part of it is, I think she's challenging one of the taboos of psychoanalysis, you know, and can we think about sexuality in a way that's not dangerous, that it's not, you know, kind of this edible thing. And I appreciate that she's trying to do that. And I believe that her patient worked it out with her.
Well, yeah, I mean, it just depends where you practice. So for instance, if I said that in Ontario to my patient, it's against the law. It's called sexual abuse under the Regulated Health Professions Act. So it would be,
Really?
yeah, it's absolutely prohibited. And
you could not say to a patient, you know, I think what you quote her as saying is I was having fantasies, sexual fantasies about you.
Yeah, well, that's pretty risky for a man, I think, up here to be saying.
I'm just kind of understanding it better. So you give a clinical example that I was fascinated by. And I thought it kind of like summarizes a lot of what we've been talking about. And the example is of your patient who wanted to murder his insurance adjuster, right? And so this, I'm sure you and I are the only ones who know what we're talking about. So do you want to say a little bit about that case, and then I'll pick up on that?
Sure. Let's see. As I recall, this is a man who I had seen for a few years. He was run over as a pedestrian walking on the sidewalk by a drunk driver, and it just crushed his entire side of his body. And he was disabled, permanently disabled, chronic PTSD from that, and he became an alcoholic to cope. And they were giving him all kinds of trouble. They're not going to pay for his therapy, and he was stalking an insurance company in town, and decided the best time to murder as many people as possible was during their smoke break, and he'd drive a tractor trailer right through the building and take out as many people as he could. And I appealed to the reality principle. I said, I know exactly what's going to happen. You're going to get arrested, and I'm worried. He's wanting to not have to work through, his own emotional pain, and by acting out, that's not going to accomplish anything. So I think that was the context.
Yep. Okay, so but then you say to him that he would be arrested and that he needed to work through his pain and victimization. Nice interpretation, right? And it seemed to affect him.
Yeah. Yeah, no, he got scared.
Well, he got something. I'm not sure what he got. I wasn't there, and I have my own thoughts. But okay, but it affected him. It changed him. He kind of stopped doing it. What were your thoughts about it? Was it just simply the reality principle that you hit him over the head with reality? You said,
no, I think that he really needed my presence, and that I'm there for you, and this is where you'll have to do the hard work that's ahead. And it was just being emotionally available and present that I think that was helpful.
Right, and I would say that in some ways you kind of defined yourself there as the good father, the good parent, the good analyst, and kind of, I'm sure you were very kind and very sympathetic. But okay, here's my crazy interpretation. We all do this all the time, right? So my crazy interpretation is that that he was devastated and felt powerless.
Yep.
And by this accident, and that's kind of an emotional state. And he was drowning in alcohol, he was doing all this stuff. So, but that what he did was he scared you. I mean, I've had patients scare me, so this is one of the, and that he scared you, and he saw that as you came to kind of tell him these things, like cut it out, but he knew in some way, that's my question, that he might have read your feelings, that there might have been a whole unconscious stream of events that was going on. And that he then felt that he kind of had some sense of power in the world, he could at least scare his analysts.
Well, that's a good observation, Joe. I I don't know if at the time would identify that as fear in that sense, but it doesn't mean it wasn't happening. And it certainly motivated me to want to intervene, because there's some other things I left out, such as the insurance company is going to have have him arrested, and a number of other things that transpired. But yes, if I didn't say something, I would be worried.
Right, exactly. I mean, I've been in that situation many times. But I think that kind of the point I'm just trying to make is that it has to do with what's going on in your subjective world. Not, and in other words, that this would be a contrast between your subjective world and the objective situation. So I don't know if you want to say more.
Well, yeah, I mean, that was going on in my mind, whatever I was conscious of. But I also think there are other aspects of reality that are operative at once. And that was one real artifact of the real world that was speaking.